Okay, thank you so much to our presenters. Those were such incredible presentations, so much rich information for us to learn from. And so thank you so much for the projects that you're working on, the research you've done, and for sharing all of that with us. Before we dig into the question and answer period, I did want to highlight that Aisling was part of that presentation, but unfortunately she was not the one introduced at the beginning of the presentation. And so just wanted to highlight that Aisling is a research associate at the University of Calgary in the Department of Medicine. She is currently working with Dr. Campbell on a community-based participatory research project that engages people with lived experience of diabetes and homelessness to act as a co-researcher and aim to identify and address barriers faced by people who are experiencing homelessness in managing their diabetes. Thank you so much, Aisling, for joining, and to Sarah and David for those presentations. We do have a couple questions in the question and answer section that I'd love to pose to you each. First of all, Samantha is asking, did you delve further into the difference between the client ratings of food security versus the provider ratings of competing priorities in relation to diabetes management?
Yeah, maybe I'll tackle that one. Thanks so much for the question, Sam. A really great question, and it was a finding we hadn't really expected, and it actually came at the end of our program of research with the needs assessment, and so we didn't get a chance to really delve into the why, because that kind of we found that at the end after we analyzed the data, and we found that there was this really discrepant finding. There's a number of hypotheses that we have about why this may be. If you think about the perspective of a person living with homelessness and experiencing that on a day-to-day basis, food is something that we're faced with constantly. We need to think about where we're getting our food, what we're making. It's always on our mind. And if you have diabetes, it's even more on your mind because you see it reflected in your blood sugars, and the food has a direct effect on everything you face all the time. Now, I think that varies quite differently from the perspective that I have as a healthcare provider, where I see the person come to my clinic, and I think we often have in healthcare certainly overly inflated senses of our own importance, that we think that we're really the key driver in people's diabetes experience, but they only see us once or twice or 3 times a year as specialists, or maybe a little more frequently as family doctors. But by and large, a chronic illness or a chronic condition like diabetes is managed day to day by a person living with the condition. And food, I think, is just much more top of mind for those people with lived experience than it might be for the healthcare provider. So those are certainly some reasons that I think, but we didn't have a chance to collect the primary data on that. But that certainly is something we've discussed with our new community-based participatory research group that we've started here in Calgary about possibly, pursuing a little bit more about why are we finding these differences in people's perspectives. Aisling, did you have anything to add to that?
No, I think that was great. And like you said, I think it's just that it has such a direct effect. And so I think it's, like you said, top of mind for people.
That's great. Thanks so much for that. There's 2 questions in the chat and in the Q&A that kind of piggyback off one another. So I'm going to ask them together. One being, how does one get involved in this project? And the secondary question to that being, are you looking to partner with other clinics outside of Alberta for your research?
Excellent questions. I'll tackle those first. So how does one get involved? I know a number of people with lived experience at this conference. And so if you are a person with lived experience who would like to partner with us in our research, especially if you're based here in Calgary, we'd invite you to reach out to us, and we'd love to have you join our community-based participatory research group that we run, and we'd love to hear your perspective. So for those lived experience conference goers, we'd love to involve you in that way. Similarly, if you know people who access services at the drop-in center, we would love to involve you in as a study participant or as a recipient of the screening program that Sarah described. For fellow researchers, reach out to me, and we'd be happy to discuss about how we can connect and how we can work together. As for the question about expanding to other centers outside of Alberta, obviously that would be a dream that we'd love to bring this far and wide, as we think that it will very much improve people's access to these needed healthcare services. But As you guys all know, in all aspects of this work, funding is always key, and we need to start small so that we can improve the effectiveness of our programs and then be able to find more funding. So as of right now, we're only funded to operate our program at 1 or 2 sites here in Calgary, but we certainly hope to expand and grow as we find more funding through peer-reviewed funding sources as well as other programs. So I'm very happy to have those discussions with anybody who would like to reach out to us.
That's great. Thank you so much. Sarah, I was just going to flip you a contact, but I can see that you've written in the chat as well. That's great. You've put your contact in there. So Annette, and in case you haven't seen that, Sarah's put her contact in the chat for you so that you can connect after this presentation. I'm just looking in the Q&A and I don't see any other questions that have come through that folks have posed, whether through the Q&A or the live chat. I'm wondering if you folks have any parting words or thoughts for both those that are on the call right now in the healthcare system, but also in the homelessness response system. Are there any, if there's one key takeaway from this or 2 key takeaways, what would you want people to be leaving with?
Sarah, why don't you go first, then Ashleen, and maybe I'll wrap things up.
Yeah, I've got lots of parting thoughts, but I'm thinking about this. This is a challenging time in healthcare, but it's really an exciting time. It's a time for us all to come together, and this conference is an excellent example of people coming together to brainstorm and look for ideas to make healthcare and people's lives better. So I welcome anybody that has any suggestions on how we could be doing this better, any gaps, any questions that they have. Please send us a note in the chat during the conference, and yeah, more heads are better than one.
I guess for me, if I was gonna sort of share parting thoughts, I would just say it's really important, I think, to remember in healthcare that people's health is influenced by so many other things than just, healthcare. And so, yeah, I would just say it's really important to keep that in mind and remember that these are people that are dealing with a lot of other things. And there might be a lot of other things that are sort of influencing their health, and to just always kind of keep that in mind when working with them, and to try to understand that as best as possible, because I think that would really improve their care.
Thanks, Ashleen and Sarah. I did see a question pop up just from Laura, so maybe I'll tackle that as well, if that's okay, Ashley. Laura was asking if we explored rural homelessness in rural areas as well, and we did not, and that has not been something we've done yet. So our environmental scan did focus on those 5 large urban centers in Canada. We know that homelessness is not just an urban issue, so that's certainly been a limitation of our work so far. It is something that we are able to do with our quantitative work. So the work that I presented at the beginning, looking at administrative health data. So in that work, we actually are able to stratify and see if we're seeing similar patterns across different jurisdictions. That is focused on Ontario data, but we can look at different areas and regions across Ontario to see if we're seeing similar disparities in rural versus urban homelessness. So certainly an area for future exploration, but not one that we've been able to tackle so far in our work. Maybe before I wrap up, see if France asked a question. Maybe Sarah, do you want to tackle that one? That's probably a good question for you, Sarah. I don't know if you see it there, but how did you get your A1C point of care device approved by the health authority? Are you able to use it because it is under the study? So I don't know if you want to speak to that.
I think maybe you might have a better idea, but yeah, we're sure. Still working through all the.
I'm happy to. So that's a really good question. So it is partly because it's under the study. So we have funding separately. So one of the big challenges with point of care devices is the funding. And so health authorities don't want to usually make them widely available because it actually is quite expensive. Every test costs a certain amount for the reagents, plus to have the device in operating order. So it's not a service they want to make widely available or funded for everyone to use. And so we got funding through the study to do that work. But in terms of kind of approvals and health authority approvals, we picked this particular device, the Siemens Vantage Analyzer, because it actually has some of the most robust data in terms of reliability and accuracy of A1C measurements. But that said, because it is being done technically outside of the purview of the health system, that data is not going to be kind of uploaded into people's provincial medical records on Netcare. So it is going to live somewhat separately outside of the official health record, if that makes sense. And I'm happy to, wrap up as well and just say that, all of this work started with many of you who are on this call, that we started this whole program of research back in 2017 by contacting and reaching out to members of the homeless serving sector. And so that includes many of the people at this conference, and we performed those 96 interviews across the country to hear about the many wonderful things that people are doing. And we were just truly inspired by what we heard. And what we presented here today isn't entirely novel, that many of the things and principles that are being implemented in our program were actually brought to us by members of the community. So we really have you and the wonderful people who work in this sector to thank for the ideas that we've generated here. And we really hope to be able to bring this program more widely, as I said, to different jurisdictions as we garner more and more evidence and hopefully more funding with that to make those services more widely available. But thank you all for being here.
Thanks so much, David. And it looks like we've got no more questions coming through. So just wanted to take another moment to thank Sarah, David, and Ashleen for this incredible presentation and sharing the research and project that's flowing from it. Thank you to everyone who's joined us on this call. I hope that you are enjoying the conference so far, and please make sure to tune back into the main plenary room at 2:45 Eastern Time for the closing remarks for day one. Thank you so much, everyone, and we'll see you soon.